Hello everyone, my name is Marta Honchenko. I'm the medical intern at the Municipal Nonprofit Enterprise Psychiatry, and first of all, I would like to thank you for the great opportunity to present my future research. The topic of the study is nicotine and alcohol dependence among male patients in psychiatric care. Nicotine and alcohol abuse are major public health concerns that significantly impact people's lives, particularly those who have psychiatric disorders. The co-occurrence of substance use, especially nicotine and alcohol dependence, adds complexity to the treatment of psychiatric illnesses. In such cases, patients often experience more severe symptoms, face longer hospitalization periods, and have poorer treatment outcomes. These individuals also at higher risk of relapse, making their long-term recovery even more difficult. Addressing this issue is crucial for improving the quality of care for psychiatric patients. With that in mind, the study I'm presenting today aims to examine how common nicotine and alcohol dependence is among male patients with psychiatric disorders. The study also seeks to assess the severity of their dependence using two widely used screening tools, the Fagerstrom test for nicotine dependence and the Cage questionnaire. The primary objective of the study is to determine the prevalence and severity of nicotine and alcohol dependence in male patients with psychiatric disorders. Specifically, we aim to understand the extent of nicotine and alcohol use, how deeply patients are dependent on the substances, and whether this comorbidity affects their psychiatric care and outcomes. We're using the Fagerstrom test for nicotine dependence to measure nicotine addiction and the Cage questionnaire to identify the alcohol-related problems. By the end of the study, we hope to develop a clear picture of how these dependencies coexist in psychiatric care settings and what kind of interventions might help to improve the prognosis of these patients. So now let me briefly explain how the study is being conducted. We used two main tools for our assessments, the Fagerstrom test for nicotine dependence and the Cage questionnaire. The study began in September 2024 and it will continue until June of 2025. Over this period, we plan to observe male patients admitted to the psychiatric department of active therapy. We are working with an approximate sample size of 60 male patients who are already residing in the department, and additionally, we expect to see the influx of about 10 to 20 new patients each month, expanding our pool of participants. When we speak about the study design, this is an observational cross-sectional study. Our participants are male patients aged 18 to 65 who have been diagnosed with psychiatric disorder. Now I want to share with you the initial results from the first 2 weeks of the study from September 2nd to September 15th of 2024. During the initial phase, we invited 64 male patients for the psychiatric department of active therapy to participate in the study. Out of this, 14 patients agreed to complete both the Fagerstrom test and the Cage questionnaire. These patients were aged between 25 and 54 and all had history of both smoking and alcohol consumption. Here is what we found. According to the test, the initial findings were quite significant. 57.1% of participants displayed high levels of nicotine dependence, and regarding alcohol consumption, 42.9% had clinically significant issues related to alcohol consumption. These initial findings suggest that many psychiatric patients suffer from more than one type of substance use disorder, which may complicate their treatment. As the study progresses, we expect to gather more data, but even these early results emphasize the needs for integrated treatment strategies that address both psychiatric disorders and substance use simultaneously. I believe the future research should focus on understanding the relationship between nicotine and alcohol use, specifically how these two behaviors interact and influence one another in psychiatric patients. To conclude, the study highlights the complex relationship between psychiatric illnesses and substance use disorders. Nicotine and alcohol dependence are often found together in psychiatric patients, creating unique challenges in treatment. These initial findings underscore the importance of an integrated approach in psychiatric care, one that not only addresses the mental health disorder, but also tackles the co-occurring substance dependence. My hope is that this research will contribute to a better understanding how smoking and alcohol use impact psychiatric patients, leading to more comprehensive, evidence-based interventions that improve overall patient outcomes. Thank you for your attention.